السلام عليكم ورحمة الله وبركاته. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Welcome to this talk that we are having today regarding our diploma programs from Shifa Holistic Healthcare Limited. My name is Walid Shauki Mukarim. I am the head therapist and head instructor here at Shifa Holistic Healthcare Limited. We are based in Kaduna, Nigeria. And at Shifa Holistic Healthcare Limited, we offer a range of treatments for various ailments using holistic medical approach, treating mind, body, and soul. We also train students from around the world in Hijama therapy, Hijama cupping therapy, and African traditional medical science. We also train in acupuncture and dry needling techniques. However, this talk is specifically on our diplomas for Hijama cupping therapy and NSQ level 1 and 2 African traditional medicine or African traditional medical science course. Inshallah, I'll be going through it with you. We are also approved and accredited trainers and therapists and practitioners. We have accreditation from the International Practitioners for Holistic Medicine, a UK-based organization that accredits and verifies practitioners and trainers around the world. We are accredited and certified trainers and therapists. We have our approval in view as NSQ training facility. We were also part of the development for the NSQ programs for traditional medicine in Nigeria from 0 draft to level 5. So inshallah, please stick around and go through with me. Listen carefully, pay attention. We're open to questions, and the more questions, the better. Inshallah, we shall do our best to answer all questions. Now, we're starting this program. It's a diploma we're running in Hijama cupping therapy and traditional medical science, NSQ levels 1 and 2. Now, why have we brought in NSQ levels 1 and 2? I will go briefly on that, and there'll be a special talk. We would have a live question and answer session to be scheduled in dates given in various groups and social media platforms for questions and answers and doubts to be cleared and more information to be shared. However, we're offering a diploma in Hijama cupping therapy and traditional medical science. We also have the advanced diploma for those who have already completed these courses. This is for level 1 and 2. In the advanced diploma for Hijama cupping therapy, it's more detailed and advanced in so many things, and we'll be going from NSQ level 3, 4, and 5 on that. Now, who's this program designed for? Those who want to learn a Sunnah way of treating ailments as a skill and profession. Doctors, physiotherapists, nurses, acupuncturists, traditional medicine practitioners, and holistic healthcare professionals. It is also open to people who just want to learn, as I said. Therapists who want to gain more confidence or learn how to add hijama to their treatments, and those who want to understand the science behind some of the things they do. Different requirements for gaining insurance in each country exists, and the need for certification comes up, especially if you are going to practice in European countries and places like that. This course is also for those who just wish to learn and treat them, friends and family, as a sunnah, and gaining the rewards of learning a sunnah and treating with a sunnah. Those who have massage qualifications, who are masseuse, yes, they could go into it because there's cupping massage. You can use the cup to massage if you know how to use it. Those who want certification that is recognized and employable by government and private institutions. Like I said, NSQ is an employable. It's a certificate verified by the National Board for Technical Education, and it goes very far. The Nigerian Skills Qualification Framework, NSQF, is a system for the development, classification, and recognition of skills, knowledge, understanding, and competencies acquired by individuals, irrespective of where and how the training or skill was acquired. This means that for all of us who have been practicing traditional medicines in various forms, Hijama, cupping therapy, our own herbal remedies, bone setters, and the whole works of it can be assessed and certified based on their knowledge and skills. Prior learning is given very grave importance. It's the sole core of this. And the system gives a clear statement of what the learner must know or be able to do in each various, it cuts across various fields, from health workers to mechanics to each, the documents I'll give you, inshallah, you would see what it's all about. The documents will be given in the groups, and you would see what has been done with that skills, not degrees challenge that was put up. Now, whether the learning took place in a classroom or on the job or less formally, the framework indicates the compatibility or comparability of different qualifications and how one can progress from one level to another. The NQS is the structure within which the National Skills Qualification operates. Now, it means that you could go in today without any certificate and come out tomorrow with a certificate equivalent to a national diploma or a higher national diploma or BSc. It goes up to PhD, and it's based on your skills and your knowledge. Now, this qualification is for those interested in developing a career in the health sector for the award of National Skills Qualifications, NSQ. At level 2, it is aimed at producing traditional medicine practitioner 2. At level 1 is practitioner 1. Like I said, these levels are graded from 1 to 9, from certificate to PhD. They are defined in terms of learning outcomes which learner must possess, regardless of whether they were acquired through formal, non-formal, or informal learning. It's nationally integrated. So this is a nationally recognized program, competency-based, which goes very far in our system as of today. As of today, this has been accepted by the Ministry for Establishment, and it's employable in the Federal Civil Service. State governments, these certificates would go there. But it is also good to note that it is in the works to try and integrate traditional medicines into our healthcare system. It is something that has been going on from the time of President Olusegun Obasanjo till date. And gradually it's getting closer that you would be able to go into the hospital and have a desk where you could perform hijama in a teaching hospital. You can perform hijama in various places. So this certification is very important for one to look towards getting it. It is, it has multi-part ways of learning. It looks at your prior learning experience and co. So we're integrating this into this program. In this program for medicine that is holistic in nature, treating mind, body, and soul. This is a program that looks at disease and sickness in non-allopathic ways. It looks at, here in traditional medical science, disease is as a result of an imbalance in the naturally existing temperament of the body. It's all based on a temperamental theory system. The change can happen at the system, organ, tissue, cellular, mental, at various levels of the body. And it is sickness. Disease and sickness is defined here as a change in the body, mind, and soul, or degradation that is beyond accepted normal. And that is why you find a lot of things are taken into consideration when treatment is being done here. As for hijama, it's very significant. It is a sunnah. So for those who are Muslims, when they do hijama, they get a special reward for treating with hijama, as long as you make your right intention. Innamal amal binniyat. So if your intention is right, you'd get it. If it is not, then you get the healing, but you might not get the reward. Anas ibn Malik reported that Nabi Sallallahu Alaihi Wasallam had said that indeed the best of remedies you have is in cupping, which is hijama. It's a hadith in Sahih Bukhari. You find the same thing in Sunan ibn Dawud and Sunan ibn Majah. These are all hadith books. Abu Huraira radiallahu anhu reported that Nabi Sallallahu Alaihi Wasallam said, if there was something excellent to be used as a remedy, then it is cupping, hijama. You find now sports people and a lot of people are going into hijama. When we talk of traditional medical science from the African perspective, we're bringing African in because everybody is developing theirs. You have the Chinese, you have the Indian, which is the Ayurvedic. Here we call it indigenous traditional medical science, but it is the same around Africa generally. So here, what does it mean? The science is actually based on the total sum of knowledge, skills, practice, based on the theories, beliefs, cultures, and experiences indigenous to different communities in Africa, explicable or not, used in maintenance of health and in the prevention, diagnosis, improvement, or treatment of physical and mental illness. Most of this has actually, we have an oral culture, so a lot of it is been documented in various places, but not as we would have loved to. So we're here. What would you be learning when you join our program? What's different? What do we offer? What do we have here? Well, we have one, the course is divided into two parts. You can opt for hijama, you can opt for traditional medical science, or you can take both. But then what you'll be learning is what is hijama, what is cupping therapy. There's a slight difference between them, the history differences, the theories behind them from traditional medicine perspective, what modern science can tell us about hijama's benefits. There's a lot of research that has been done and is still being done. Introduction to the organ systems of the body and functions of blood and lymphatic fluids. This is based on the science that hijama is based on. Here in Nigeria, in northern Nigeria, where I am, hijama has been around for as far as I can remember, but it was called kaho, done traditionally by some traditional medicine people who they would want to give them a name like a traditional barber, but they're not. They're actually more than that, because they do a lot of things that treatments that are related to their own knowledge of medicine, as it is. But it's been there. It's called cupping. It's called hijama. So it's been there for a very long time, and there's a lot to learn about it. We would also be talking about communication in your workplace, teamwork as a medicine health practitioner, health and safety in your workplace, basic concept of anatomy in traditional medicine, basic concepts of physiology in traditional medicine, diagnosis and treatment in traditional medicine, identification and collection of medical plants that you would use, how you dry them and store them, the techniques that are there, and you'll understand why they are there. You will also learn about this temperamental theory. African traditional medicine practitioners used the temperamental theory to describe seasons, natural elements, human body structure, parts of the human body, and internal body structures and organs. It's also used in classification of diseases, disease conditions, as well as differentiation of the various syndromes. So you'd be coming about hot, cold, hot, dry, hot, damp, where cold, dry, cold, damp, temperaments, and this goes in various levels, and everything can be described with this theory, and it'll come to light, and you'd understand why you would find traditional healers in various parts of the countries treating the same ailment using different herbs. Some herbs don't grow in everywhere, so you find them using different herbs, but they get to the same point. There's a science behind it. There's a theory behind it. It's not done blindly. This temperamental theory is used in classification of these materials that they use, and like that. So, inshallah, we would talk about that. We would be looking at introduction to herbal medicine preparations, both Islamic preparations and traditional preparations of plants we have here. You see, yes, it's good to talk about those plants that are there. Teen, or teen is zaytun, or tur sinin. Zaytun is good, teen is good, abat sauda, coastal Hind, and a lot of them, but it is not available everywhere. So what do you use in place of it? And how do you know that it would work? What is your knowledge? These are things you'd come to learn. How to consult your patients, consultation with your patients, diagnosis, how to understand test results that your patients will come to. Most patients will come to you having been somewhere. They don't come to you as a first option. They normally would come to you as a near last option after going round. So they'd come with a lot of test results. This becomes a reference point for them. So when you treat them, you could ask them to go and verify from the tests they're getting better, because a lot of them keep that in your record keeping for your treatments. You learn how to perform hijama properly, best practice clinical aftercare for your hijama patients, and what you can treat with hijama and what you cannot treat with hijama. Some ailments we will discuss: hygiene, health, safety considerations would be taken care of, traditional paradigms for best results. Each thing has a reason, and you'll understand why it is done like that. Your equipment lists, safe disposal, and other considerations you should take into there, your best practice, like we said, and treatment protocols. There'll be practical class demonstrations where, after being taught, you'd be seen to do the same thing online, assuming you were not able to come to Kaduna for the clinicals, but you would treat and we would monitor. And alhamdulillah, we've had good results from this. And we are very happy with the results we're having. Hands-on practical classes will be here in Kaduna, Nigeria, and we'll be teaching you how to counsel your patient and prepare them for treatment, how to prepare some of these herbs, like we said, how to administer them after preparation. You learn some things about preventive disease, nutrition, and disease prevention from your diet, because a lot of ailments you treat: high blood pressure, diabetes. Also, these are most common things that you find now: PCOS in women, fibroids, infertility, erectile dysfunction. These are all lifestyle ailments, things that are linked to lifestyle. You learn how to package your drugs, how to conserve them. There'll be theories on the points and contraindications to some of these things. Like we said, a number of these things we would be looking at as we go along, and treatments that and ailments we'll be looking at would include, but not be limited to, memory problems, like I said, erectile dysfunctions, digestive issues, arthritis, back pains, blood pressure, asthma, and some other ailments that during the course of the program we would look at to be decided by the students. We might vote on some and might just decide to add some common ailments that are there. And for those who are doing the Hijama course or just the African traditional medicine course, there'll be small intermix, but all of these are things that would be learned, inshallah. Like we said, we're looking at this, and now what do we define as medicine here? Definition for medicine from our own point of view and traditional medical science is any intervention aimed at promoting health, prevention of disease, diagnosis, and treatment of physical, mental, and spiritual ailments by a qualified practitioner. That is where we need knowledge. فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Allah subhanahu wa ta'ala says we should ask those people of knowledge if you don't know. And that's the only way you would be able to get to that point where you'd be useful to yourself and useful to society. It is very important to understand these and to follow up on it. It is very important to be, to do, to learn. If you do not learn and you practice, then you'll be committing a crime before Allah subhanahu wa ta'ala and before men and yourselves. Now, here, for those who would be doing the practicals here with us, we would be giving them a kit that would be used by them. The kit will comprise of hijama cups, gloves, lancet needles, cotton wool, olive oil, methylated spirit. It will all be cased so that the moment they leave, they can start their practice and hit the road running, as it is said. Now, like I said, the classes would be online and offline. You have the Diploma in Hijama Cupping Therapy. It's a 6 months program. You have classes 3 or so times a week. It'll be given online, and towards the end of the program, for those who will be coming in for the practicals, it will be arranged for a 10-day or so, 7 to 10-day program for practical in the clinic and treatment techniques there. Most of this would be given live or in the online classes. And for those who are not able to come and are doing the classes online, we would be giving supervised practical training, as was said. The Traditional Medical Science Diploma 2 is a 6 months program. So like I was saying, you have online and offline courses for both the Hijama and the cupping therapy. The online program would have practical discussed online. For the traditional medical science, it is 6 months. You have online theory classes, discussions and classes. You have the online training introduction to plants and identification and preparation. But for those who would be able to be here, there will be hands-on practical training in introduction to plant identification and preparation. So you can actually feel the plants that are there. You actually taste them, smell them, and do a number of things that if you're online, if you can find those particular plants, then you do the same thing too. The diploma in Hijama cupping therapy and traditional medical science would be a 9-month program. It will be comprising of both things that have been discussed earlier. And inshallah, all practical classes will be held at our facility in Kaduna State of Nigeria. And should you wish to contact us, if you're on the groups already, then you just ask your questions. If you're not, you can link us to any of these links given here by mail, through Facebook, or through our website. You can call any of these numbers and you could be added to our groups, inshallah. That is the program for you. Bismillah ta'ala. We look forward to you asking questions, you seeking more knowledge, but most of all, we look forward to you being a part of this program that we would be running, inshallah, part of healing and curing as we go along, seeking good health for ourselves and those around us. Thank you for being here, and we're open to questions. Like I said, you can chat the word in the groups, you can ask, and we will give you answers. Inshallah, there will be a question and answer session. The date will be set and given in the groups, and we look forward to you being there. والصلاة والسلام على سيدنا محمد وعلى آله وصحبه وسلم تسليما كثيرا. السلام عليكم ورحمة الله.